The impact of schizophrenia on families is often very distressing and disruptive. Parents often assume that early signs are normal: aggressive behavior, strange behavior, academic failures in school, or even suicidal attempts. Don't wait until these signs and symptoms have gotten out of control and increased stress and confusion results. Coping with continuing symptoms can be very difficult for the family, and no one has to pretend to be superhuman to deal with their child. If you or someone you know is battling with a child with schizophrenia or any type of strange behavior, seek help and get the help that you deserve. You don't have to battle this disease alone.
Oh, you could kill me. I hope she ain't growling and carrying on today. Amanda, where the hell you just coming from? Where you just coming from, girl? Mommy, listen. Not today. Not today. Amanda, you see what time it is? It's almost after 1, girl. Me, how is almost after 1? Where your phone is? I've been calling your phone, Amanda. Your principal calling me today. You've been to school. I dropped you to school. I ain't into that today. I had a long day, and guess what? I ain't in the right mood, so don't do it. Amanda, don't do it. I ain't take this from you. I can't take this from you no more. I had enough. I had enough. Oh Lord, what I could do with this shot? What I could do with this shot? I can't take this no more. I can't take this no more. This bird, oh Lord. Miss Karen, what is all this fuss about? Oh Lord, Sharon, I know what I can do with this girl. I can't take it no more. I can't take it no more. Miss Child talking to herself. She cutting her wrist. She ain't even keeping up with the school work. What? She ain't doing that. She tried to fight me the other day. Sharon. I can't take this no more. What am I supposed to do? She needs help. Maybe you should get her some help at Sunderland. What's that? You know, crazy people in my family, girl. What you talking about? She could get proper care there. Proper care? I know a friend named Jenny Roll. You could give her a call right now. Jenny? Yeah, Jenny Roll, my friend. Okay. Well, what the number is? Because I know what I can do. Her number is 323-3893. I could call her right now. Give me a minute. Let me compose myself. Hello, Jenny. Yes, I get your number from my neighbor. I have a daughter, and she is out of control. I know what I can do with her. I need your help. Well, you can set up a meeting for me tomorrow? What time? 10:30? Okay, I'll be there. I'll be there. I try my best to get her there. Okay, thank you. You're here? Karen here. Okay. This is my daughter. This is my daughter, Amanda. Hi, how are you, Amanda? I've heard so much about you. Come in, come in. Yes, I was able to get the appointment with the psychologist this morning. Thank you, very much. So let's just go right up to her. She's waiting on us. Okay. All right. Excuse me. Come on, come on. How are you? Let's go, girl. Come on. Good morning, good morning, good morning. Richard, how you doing? Morning. You alright? Yes. Yes, so I brought my clients in. I'm Miss Karen. Okay. You know, I called you all yesterday. And her daughter Amanda. Come on. Come on. Miss Karen. This is Miss Karen. This is Dr. Richard. Hi. This is our psychologist at the Rehabilitation Center. And this is Amanda. Just come on. Just come inside. Just take a seat. Come on. Come on, darling. Don't be shy. Come on. Come on. This is our psychologist, Dr. Richards. Come on. Come on. Come on. Amanda, sit down.
Richard, how you doing?
Everything's good.
That's great. Amanda, say hello.
Hello. What's your name?
Fidgeting.
Hi, Amanda.
Amanda, what brings you here today?
I don't know what happened. But my mommy bring me up. I don't know.
Stop fidgeting.
Leave me alone, man. I'm on your run. I just feel so mad. I feel really angry. I don't know what happened.
Okay, Amanda, and that's how you generally feel most of the time?
Yes.
Most of the time you feel angry. Amanda, do you hear voices?
Yeah, I always hear voices. I was hearing voices from I was 10. I'm 16 now. And those voices, they tell me to do bad stuff. To cut myself, see? I get cuts here. And then this big one, I have this big one. And
Show them the one on your leg.
for me. And I have this big one right here on my leg.
Oh wow, gracious.
So Amanda, every time you get angry, you just cut yourself?
Yeah, I cut myself and then I go for a long time.
So Amanda, so every time you get angry, you just cut yourself?
Yeah, I cut myself because that's what the voices tell me to do. I hear them and I have to do what they say. I always hear them. If I don't do what they say, I just end up doing bad stuff.
Okay, Amanda. Is there anything that ever cheers you up?
No.
Nothing ever cheers you
No,
up?
nothing.
Okay, Amanda, you ever felt like killing yourself at any point in time?
All the time, I always feel like I want to kill myself.
Okay.
And I remember when I was 10, I went walking down the streets, and we ended up in the bush, me and my mommy.
Mommy, tell me more about Amanda.
Dog, I don't know where to start. I don't know what I do with this girl. I don't know. I tell you, she just been behaving terrible for the past like 6 months now. All this stuff from she was 16. Amanda been cutting herself. She been ducking school. She
Mommy,
ain't no work
I was
around
10
the house.
that
time. I was 10.
Amanda, you was at 10. Listen to me, dog. Listen to me. I fed up. I had enough. This is my last resort. You all have to do something for me. You all have to do something to help me, because I don't know what I can do. Okay, Amanda, can I do a little exercise with you? Okay, this is a chair, and this is a table. Can you please tell me the difference between those two? The chair and the table.
Oh, the chair and table.
Yes.
They had.
Okay, Amanda. The psychiatrist and I will set up days on which we'll meet you, and Dr. Hepburn will get back to you, okay?
Hey, how you doing? Hey, Richard, Two Top, how you doing? Girl, I have admission for y'all. Unfortunately, I know me ain't want no admission, but I got an admission against 17-year-old girl, Amanda.
Okay.
Right now, based on the MSC what Dr. Richards gave me, this schizophrenia all the way. For the past couple of months right now, she's been having auditory hallucinations, giving her commands to kill herself, cut herself, you know, along those lines, okay? Also in the MSC, they're saying that basically, you know, she usually have an aggression towards her mother, fighting, rebellious, coming home late. All of the signs that we usually see is going on right now, okay? So definitely we need high risk for suicide throughout her notes, okay? She has about 3 marks on her skin, 2 on her arm, and a huge one on her leg. So right now we need observation, close observation. We don't need no death on our ward like that, all right? Yeah, so right now socially she's withdrawn. She don't talk to you, she don't answer you. I mean, this girl just out of it, okay? So you gotta work with that. All right, so right now for treatment, definitely I'm gonna put her on meds. Because she's just getting diagnosed, I'm gonna put her on just Respirodol, 2 milligrams, POB/BD, okay? Now that should tame her for right now. Now I'm close observation, I'm gonna put her on something else, but for right now, I just wanna start her on an atypical drug, just something simple, and watch how it progresses, and if it's effective, then great. If it isn't, then we're gonna put her on something else. Also, right now, we need some psychosocial interventions. We're gonna put her definitely,
give her the therapy, the psychosocial therapy throughout the week, probably about 2 days, and then occupational therapy for the rest of the days, because she is 17 and she's gonna have to stick with her, different, learning and all of that. So she'll be on adolescence ward for now, but occupational therapy, I'm gonna set up a little meeting with them where they try to get the curriculum from her school to try to tailor it just towards her.
Okay.
So I'm gonna have to speak with her mom in terms of family therapy to see what's going on in the home, okay? To try to get them in and just, a little counseling for them. All right. Now with the medications right now, it should alleviate her symptoms such as the depression and the hallucinations, and as well as right now, it should just try to get a little more active. Okay. Now, so I'm gonna talk to her mom. Okay, and then I'm gonna come back in. But let me just go talk to her mom and tell her about the admission.
Okay.
All right, and then I'm gonna come back to you.
Okay.
But for right now, just start. She's definitely admitted.
Okay.
I'm gonna sign off on everything. I'm gonna come back. Just start getting the folders and everything ready. Risperdal,
Okay.
2 milligrams PD. Okay.
No problem.
All right.
Okay.
They're up here, right? Hello. How are you?
Hi.
My name is Dr. Hepburn. I'm the psychiatrist. Hello. Your name Amanda? How you doing?
Hey.
All right. How are you both? You all right, Amanda? You're fine? I can imagine. All right. So I got the information from Dr. Richards. You had a meeting earlier this morning with the psychologist, and she handed over all the information to me for me to make a diagnosis and to tell you what I think is going on and where we're gonna move from here.
Right.
Okay, so for right now, based on the information that I've received, okay, your daughter has a condition called schizophrenia. Okay, all right, so yes, your daughter has a condition called schizophrenia. Okay, just like any other condition, diabetes, mellitus, all of that, it requires management. Okay. Now, this is a mental disorder, so therefore it isn't a quick fix, but it's something that we're going to have to work towards over a period of time. Okay? Now, so you stated in the interview this morning, with the hallucinations, she's get commands to kill herself. And unfortunately, that is quite common in persons with schizophrenia and die. So in the interview this morning, I see here where you stated that, and she stated as well, she's been having attempts to commit suicide. She's been hearing things that's been giving her commands to kill herself. And that right there is a common thing in persons with schizophrenia. And believe it or not, this age is quite normal. Okay, anywhere between mid-teens to mid-adulthood. So this is the time, this age bracket, where clinical symptoms usually come out in students or in persons. Okay, so right now with schizophrenia, she has a different concept of reality. Okay, so she's having hallucinations and she's believing that they're true. Okay, and it's not that they're not true to her; they are. Okay. Who are we to tell her, okay, she isn't experiencing, okay? So right now, we're going to have to admit her to the ward, unfortunately, because with her symptoms...
So I going home?
Yeah, no, sweetie, you're going to have to be admitted, because with your symptoms, it's quite dangerous. We're usually persons with schizophrenia.
So I go now.
Amanda, no, Amanda, baby, you have to sit. Relax, okay?
So...
I know. Let me finish talking to mom, okay? So right now, with persons with this disease, it's usually a 10 to 15% of actually committing suicide. Okay, so right now at this stage, she's having hallucinations. We have to keep her in. Okay? Now during this time, I assure you she's going to be safe, and we're going to go towards the full management of her, trying to, alleviate the symptoms of the aggression and the fighting back and all of that. Okay? Now, before I go, I want you to know that I put her on some drugs. Risperdal is one of the drugs, and it's actually antipsychotic. Okay, so it's gonna help her with the hallucinations to alleviate the symptoms. With her moods, it's gonna help to bring down her mood. She's agitated and irritable, so it'll help to all control that. Okay, all right, and also now we have some psychosocial therapies that is going to be put into place. Okay, so we're going to need you as well, family therapy, as well as we're going to have her where she's actually going to occupational therapy. Okay. And that's where she'll still be in her books, person comes in, based on the curriculum in school, they're going to be teaching her, and she's going to do stuff with other patients,
right.
In terms of academic excellence, as well as socially, stuff just to keep her mind away from the disease itself. Okay, so that's basically it. Like I tell you, Sandulans, we have a high standard, and we're gonna get through this together.
Okay.
I reassure you that we're gonna get through it together.
No.
Baby, we're gonna have to admit you tonight. Unfortunately, we're gonna have to admit you, and there's nothing else we can do. Okay? Yes, I know it's hard for you, but we're gonna have to do what we have to do. Okay? Amanda? Yes, I know. I know it's hard, but that's what we're gonna have to do. Okay? This is a mental condition that you have, and we have to deal with it now before anything else bad happens. Okay? Alright? So, Jess' mom, you can call anyone, to bring in some clothes for her. And we just want to observe her for the next few weeks and see how it goes, if it lasts, or if it discontinues for a little while. Okay?
Okay, though.
Alright? So, Amanda, I'm going to need you to pack up your bags. And we're going to go on to the ward, okay? Is that okay? Alright. Amanda, what are you doing here?
Nurse, we was in, but what you want?
Amanda, you're refusing to take your medications?
Nurse, I don't have to take no medications. Every time I see you, you want me to take medications, take medications. I'm not taking more medication.
Amanda, that's the only way you could feel better.
Nurse, I just tired of taking medications. Every day I have to take these medications,
Amanda, there are people with this condition that still live normal lives.
Nurse, I can't deal with that no more.
Amanda, you can do it. If those people could do it, you can do it too. Okay?
Yes, Nurse Richards.
Okay.
Okay, hi Amanda, how are you? My name is Nurse Skills. Today, I'm going to be focusing on trying to get you to not pay attention to the voices in your head, okay? So tell me how you feel.
Listen, why all y'all people asking me these questions and things? I'm into this today. You here, the nurse bothering me, the doctor bothering me. I can't take this. I'm into what you have to say. What you have to say today? What you want me to do now? What you want me to do? Because guess what? I tired of talking to too much people now. What you want me to do?
Bear with me, Amanda. I just want you to just calm down and tell me everything that you see in this room right now.
What I can see?
Yes.
What you mean like what I can see?
Just tell me anything that you can see.
I can see the door and I can see you.
You see the door, you see me. Okay, tell me what can you hear?
What I can hear? I always hear stuff.
No, tell me what you could hear right now.
Oh, right now.
In this room, yes.
I can hear you talking to me. I can't hear nothing else.
How do you feel?
I feel tired, I feel agitated. I got all these questions.
How do you feel in this room? Like the temperature?
It's hot, it's hot. You see me sweat, I sweat, I ready to go.
Okay, so you know the purpose of this exercise?
No.
The purpose of this exercise is to get you to focus on your immediate surroundings. I need you to start focusing on what's going on in reality and not pay attention to the voices in your head. Okay? So I'm going to let you do a little exercise. I want you to read this book, and in 2 days...
Read this?
No, not now. I'm going to give you this book to read, and in 2 days, I want to come back and reassess you to see if you could understand what's going on.
So I keeping this with me on the wall?
Yes, I want you to keep this book. I want you to read this book, and I want you to be able to...
Hold on. I can't do that now.
See, this is the purpose of this exercise. Get you not to focus on what's going on in your head.
You didn't hear that there? You hear that?
No, I didn't hear anything. But just know that what you're hearing, it's not real. Okay? So we can start today. We can
Well,
start, we
what?
can start you with just this book today. Okay?
So I carry this book
And
with
2
me?
days, I'll come back and reassess you.
Oh, so I can read this on the wall in my room then?
Yes.
Okay.
Okay, so you can go back to your room now, and I'll let the nurse know that our session is over. Okay?
Okay.
Hey, how you doing? So I've gotten a word from the doctor, and Amanda's doing well. I think that's so awesome. I mean, from the time we came in, and she's having so much problems with her mom. I mean, I heard she's doing really, really good. So the doctor told me that she's up for discharge.
Okay.
So I went to the house, and I, did a little assessment of the area. And as far as I'm concerned, in terms of the house, everything is complete shape. She's going back to a safe environment, no hazards, nothing, nothing to, hurt her. Only thing her mom has to do right now is just to try to be on her back, watching her, not too much on her, but, just guiding her, making sure she don't do anything to hurt herself, Also, what I noticed too was like she comes from a good home. So right now, placement back into, society per se it's looking good. Okay, so where is she? I could probably talk to her mom just for a bit.
Okay, and this one over here.
Oh, so Monday you're getting discharged finally. I'm so happy for you. Oh man, it's been a long, long road, but we're here now, huh?
Yes.
Seems just was like yesterday, huh? Well, that's great. That's great. I mean, it was a pleasure meeting you both.
Thank you.
This has been a struggle, but we together we're gonna get through it. Okay? So all I can say, just have a safe life. Just be careful. Take your medications as ordered by the doctor. Just make sure. Remember, we're here. You can come in anytime you need anything. Just come on in. You could call me. I'm your social worker. So you could just come in, call me, and I'll set up any appointments with the doctors, okay? Now you do have an appointment on the 18th of December. Just for a follow-up, okay, Mom? Okay. So make sure to bring her in on time for 8 o'clock sharp.
No problem.
And then most likely we'll be seeing the same doctor, okay? So just bring her on in. Just, close observation. Suicide is a big thing with schizophrenia. So anytime you're having hallucinations, remember what your activity therapist say. Take your medications. Just be open with everyone, Mom, be patient. And we'll be on the road to success. All right? Thank you so much. It's been a pleasure to meet y'all.
Thank you too.
Thank you all the best. All right? Bye-bye. Come on. Yes.
Hey, Amanda.
Oh, hi, Miss Richard.
Hi. Look at you. You're doing so much better now.
Yes, ma'am.
You're taking your medications. You're interacting with the patient.
I'm feeling better now. I made a friend with Karen Riddle this now.
Oh, that's great.
Yes,
And
ma'am.
the activity therapist told me that you did very well today.
Yeah, I'm feeling really good now.
Okay, Amanda. So all you have to do now is continue taking your medications, and you'll get away, okay?